All right. Hello, everyone, and welcome to Applied Behavior Analysis Services webinar. And I have Emily here as our guest. I'm Dr. Leslie Pascoe from MyOway Centers for Kids, and we're hosting today. So let me tell you first a little bit about MyOway Centers for Kids. We offer early growth and development intervention for children's jaws and airways using myofunctional therapy techniques paired with specially developed medical appliances. The aim is to help children's jaws and airway structures grow right so they can breathe right and they can live better lives as children, but also into adulthood. Science demonstrates that 90% of children have underdeveloped jaws and airways, leading to sleep-related breathing disorders and daytime mouth breathing. These conditions contribute to medical and mental health issues such as anxiety, hyperactivity, inability to focus, digestive disorders, heart-related issues, and even bedwetting. These are just to name a few. Our programs are 6 to 12 months long, and they help to correct poor oral habits such as thumb sucking, chewing habits, and mouth breathing by strengthening the muscles that the child needs to grow and develop properly. Our programs are affordable and can cost less than swimming or piano lessons. Early intervention is the key, so we see children from birth on up and ideally before the age of 5, so that we want to make these programs available to everyone. We have payment options and all sorts of things in place so that every child could go through our program, every child in need. We're located in Wexford, and we thought it would be great to have Emily today on our discussion because we help children and their families, and so does Emily. I thought it's a great opportunity to hear from her because she's a board-certified behavior analyst, and she helps parents and children with behavior questions. So to give you a little bit of information about Emily, she obtained her bachelor's degree in elementary education and minored in special education from Point Park University in 2013. Following her graduation, Emily taught at public schools for 2 years. She worked with special education students in general education as well as self-contained classes. In 2015, she started to pursue her master's degree in ABA at Shenandoah University in Winchester, Virginia. To obtain her practicum hours needed to sit for her exam, she worked over the summer at a private day school for clients with severe problem behaviors. She enjoyed her work so much over the summer that she accepted a full-time position at the school in the fall of 2015. Emily worked as a direct service staff licensed special education teacher and was promoted to program director. She worked with a team of 8 students and 8 staff developing goals, writing IEPs, and training staff. In May of 2016, she obtained her BCBA credential. In the summer of 2017, Emily moved back home to Pittsburgh. While living in Pittsburgh, she teamed up with a friend from a private day school to provide ABA services to clients in Morgantown, West Virginia. Now she wants to expand her reach to help many more families closer to home. Emily enjoys writing behavior plans and showing families how to decrease problems with behavior while at the same time increasing functional communication. She has had experience with many different types of maladaptive behaviors, as well as working on functional goals, independence, and increasing communication. In her spare time, she enjoys spending time with her husband, Steve, her toddler son, Jacob, and their dog, Rex. So it's my pleasure to introduce Emily, and I want to let everybody know that obviously she has a lot of experience in this area. We have even used Emily's information and input to help our programs at MyOway Centers for Kids. At the end of the meeting, we'll answer any questions. Please feel free to put them in the chat. So Emily, go ahead and take it away.
Sounds good. Thank you for that introduction.
You're welcome.
So hopping in here, as Dr. Leslie mentioned, I am the Executive Director for the Behavior Institute. We are located in Avalon, and so we primarily work with kids who have that autism diagnosis, but as we'll learn throughout the presentation, that ABA can be beneficial for kids and adults. They don't have to have that autism diagnosis. So specifically, what is ABA? So ABA is the study of human behavior. We use evidence to change behaviors that are socially important. And one of the big concepts is that if we add things to someone's environment that they like, even if we, as the givers of that reinforcement, don't think it's a reinforcement, if it increases their behavior, it was reinforcement. And so we can look at those to try to figure out, how we can add more of that reinforcement to continue with that good behavior we want to see, or take that reinforcement away to decrease those behaviors we don't want to see. So the biggest thing to know about ABA is that it is that evidence-based treatment. So that is treatment that has been scientifically proven to be effective for reducing symptoms of a specific condition. And ABA is kind of the foundation of evidence-based treatment for autism. So it is the #1 evidence-based intervention. ABA is the study of human behavior. So it utilizes techniques like positive reinforcement, visual schedules, and increasing independence. And then specifically when we're thinking about kids, especially kids with autism, and when we're billing insurance for ABA services, some of the things that we can work on in that regard are communication skills, their motor skills, functional skills, social skills, and then decreasing problem behaviors and increasing more appropriate behaviors. ABA, I don't know if any of you have a lot of familiarity with it, but there are a lot of myths out there with ABA. I say that because it's a newer science, really developed in the 50s and 60s. We really have faced our fair share of criticism over the year. So ABA therapy, one of the myths is that ABA therapy isn't science-based. So the U.S. Surgeon General and the American Psychological Association do recognize ABA as the best practice for children and adults with autism. Another myth about ABA is that ABA will want to make my child a robot. ABA looks at each child individually and wants to help them reach their maximum potential. We look for qualities. When you're looking for a quality provider, you want to ensure that you're working on goals that are age appropriate and that do include things like the positive side of things. We really focus on the reinforcement of adding things into their environment. I would typically recommend avoiding a provider who wants to remove things like stimming and things like that. So knowing who you're dealing with before you kind of sign your kiddo up for a service is super, super important. Another myth is that ABA is only effective for people with autism. As I mentioned earlier, ABA is the study of human behavior, so it doesn't have to be specifically somebody who has autism. It looks at how we react in our brains to the stimuli that we are introduced to. There are BCBAs in my field who work with, large corporations to help managers kind of understand how to help their teams do better, have more production, deal with conflicts within the, larger organizations and things like that. So there are definitely a lot of subsets for ABA. Unfortunately, the insurance funding is where, the autism piece kind of comes in, that most insurances will not cover ABA services unless a child has an autism diagnosis. But ABA has, there's evidence out there, and ABA has shown to be effective with, lots of different groups of people. And then the last myth that I chose to, kind of highlight here is that ABA uses punishment and will require my child to sit for multiple hours. And here in the past, that kind of was the norm for ABA. If you, YouTube ABA services, you will see a lot of kids, sitting at tables for long periods of time. I would say that myself, as well as the providers that, I have, been involved with, have worked really hard over the last several years to kind of create a new name for themselves, where we kind of move away from more of that intensive teaching at the table, and kind of looking at, where is this kid developmentally? What is age appropriate for them? What are things that are super important to them and their families? Our approach now uses a lot of play-based therapy and things like that to kind of get the kids' motivation there, to want them to want to do the things that are needed to kind of get them to that end goal that we're looking for with them. When we talk about our recommendations, this can vary from clinic to clinic and kid by kid. Most of the time, the commitment for hours of ABA is much different than speech or OT. Most clinics recommend, upwards of 10 hours a week to kind of see the results that people are looking for. The research that's out there, some of it suggests that anything less than that 10 hours can, produce little to no results. So it's super important that if you're getting an hour recommendation for ABA, that you understand the reasons behind it. For my company, we utilize an assessment called a medical needs assessment. And this allows us to input the information about that individual child, looking at their past history, their current deficits, and things like that to kind of make an hour determination. Other questions that are part of that assessment are about their social skills, their communication, and then those restrictive patterns of behavior to kind of help us figure out how many hours would be appropriate for that child. So it's very individualized for each client. To tap into the functions of behavior here. So the way that you can remember the different functions of behavior is SEAT. So the S stands for sensory. This is where there's no outside influence on the particular behavior. These are typically things that just feel good. They can be stimming behaviors. So hand flapping, toe walking, some vocalizations. And these are things that are kind of mediated internally. So nobody has to do anything for those behaviors to continue. They're just things that are that internal piece. The next one is escape. So these are things that are times when your child gets out of doing something. So you've told them to take a bath, they have a behavior and you no longer require that bath. They just got to escape that bath. The next one is attention. This can either be positive or negative attention, or it could be both. So sometimes when our kids are doing something that we don't like and we tell them to stop it, we are giving them attention there. And if that's something that they want, we're going to see that increase, even though it was more of like a negative phrase of stop, don't do that. It could also be that positive attention piece of great job, I like what you're doing. So those are the two components of attention. And the last one is tangible. So getting access to things. So things like food, their iPad, their favorite toy, all of those sorts of things can fall into that category. So when we're looking at behaviors, we're really looking at why the behavior is happening. It typically follows into one of these four categories. And if it's a behavior we don't want to see happen, then we would talk about how we can do the opposite. So if you're letting your kid escape getting a bath after having tantrums, we can talk about the strategies that we can utilize to have them ask for, more time or ask to not take a bath. So they're doing some sort of functional communication rather than having that behavior get that need met, because you're going to see that more often in the future. When we're trying to determine the function, the ABC context really kind of comes into play. So ABC stands for antecedent, behavior, and consequence. When we talk about an antecedent, it's what happens before the behavior. So in the instance of the child not taking a bath, you presented the demand of let's go take a bath. So that's your antecedent. The behavior is what the behavior looked like. When we talk about behavior, we want to make sure that we are very clear and objective and observable with it. We don't want to say kind of overarching terms like, oh, they were aggressive, or, oh, they had a meltdown. We want to really know what that looks like. So the behavior in that situation would be, that the child, laid on the floor and kicked and screamed. And then the consequence is how you responded. So the consequence in that situation most times is that they don't have to take a bath. So they got out of taking a bath, which is what the consequence was. The consequence, we want to make sure it's not focused on the negative piece of oh, they had to sit in timeout, or they had to lose their iPad for 5 minutes. The consequence is just how you responded to something. So next up, just talking a little bit about an extinction burst. So an extinction burst is if we stop reinforcing a previously reinforced behavior when things get worse before they get better. It's really important for parents to know about these sorts of things if they're trying to change behavior, because sometimes when you try to change behavior and you're making that change of, I'm not gonna, let them have that meltdown or that tantrum and get what they want, the behavior is going to get worse before it gets better. And so you should know to expect that, because what happens is if you don't know to expect that and that happens, you might start to think that the new process isn't working, it's making things worse, and that you don't want to continue with it. Knowing that it's going to happen kind of allows you to be prepared for it. And what's happening in that moment is the child's kind of trying to pull out all the stops at that moment to access that reinforcement. So to avoid going to the bathtub or whatever it is that they were previously allowed to avoid or escape doing. So when that happens, we want to stay the course and stay upon the decided plan, communicate as a team, contacting the people that are helping you along the way. Definitely depending upon the severity of the situation, working with a board certified behavior analyst to kind of help work through that can be super helpful. But having everybody on a team be consistent is super, super important. So if multiple people give your child a bath at night, mom, dad, maybe grandma, having everybody responding in the same way is going to be super, super helpful, because if one person continues to allow that tantrum to escape the bath, it's going to make it much harder for all of the people as you guys try to work through that. So some ways to prevent that extinction burst is really thinking about the reinforcement that you're offering. So we want to make sure that we're providing opportunities to provide that praise for behaviors that we want to see. Especially if it is an attention-based behavior, we want to be providing that positive statements and things like that. Consistency, like I talked about, having everybody who works with your kiddo on the same page is super, super important. Communicate with that team. So reach out if you have questions. If you don't have anybody involved, just that communication among, mom, dad, and grandma to make sure that everybody's kind of seeing the same things, and, that you guys can kind of talk through problems that might be happening. And then stay the course, especially after you've decided to make that change to no longer allow the tantrum to escape bath time. You don't want to kind of switch it up again. If you start it for a little bit and then you take it away, we're just kind of building up that persistence in the kiddo where they learn that they have to, cry for 12 minutes before mom and dad give in. So it's really important that once you commit, that you try as hard as you can. And working with a BCBA, they can talk you through that. They can explain, where you are in the process. They can give you new ideas and helpful tips and things like that to kind of help you get where you want to be. When we talk about our behavior, it's reaction, reaction, reaction. So we really want to remain neutral, have your body language and facial expressions and vocal language all be very neutral when you're dealing with a problem behavior. Sometimes the kiddos feed off of our emotional reactions to things. They can see that they're pushing our buttons, and sometimes they think that's funny. And so, then we get into that power struggle where then, we are getting more upset because now they're laughing and they think that what's happening is funny. And so it just kind of becomes this vicious cycle. You also want to think positive. So make sure that you're giving praise for things that you want to see, even if they're in the middle of a meltdown or a tantrum. There might be some positive things that are happening, or, you're kind of prepping your brain for those positive things that could be coming next. So making sure that you get in there and try to praise those sorts of behaviors so that you're giving that attention for the things that you want to see. You want to try to ignore all other forms of behavior. Keeping safety in mind. So if there's something that's happening that, safety wise, you definitely want to intervene there. And try to think ahead. So where might this behavior go next? Where could this situation go? Like, what can we do as the adults in the situation to try to make things better? And the last piece that I have here is just trying to avoid any negative reactions, avoiding having too many people involved. If something started with mom, trying to, just kind of limit it to that. If somebody else tries to come in and start prompting the kiddo, sometimes they just become like super overstimulated in that moment. And now they're not listening to mom or dad, and there's just a lot of kind of chaos going on. So definitely trying to limit the amount of people. Next up, a big thing that I kind of see or hear from parents is the difference between bribery and reinforcement. So I just wanted to touch on that a little bit today. So when we talk about bribery, this is typically rewarding someone for doing something that's unethical, corrupt, or illegal. It's also given after a behavior starts. So you have that kiddo in the store having a tantrum and you're like, hey, if you stop crying, I'll give you a candy. Whereas when we talk about reinforcement, we want it to be used to increase a behavior. So we want to increase that good behavior that we're seeing. And we also offer it prior to the start of a behavior. So if your kiddo typically has a tantrum at the store, my strategy would be, okay, I have this candy bar, you can have it, at the end of our trip, if you have a calm voice or something like that throughout the trip to the store. So it's offered prior to there being any problem behavior. And it's not in response to that problem behavior. If we start doing the bribery, if we start adding things positive things. If you stop doing this, I'll give you that candy. We're going to see more of those problem behaviors because now we've, introduced that reinforcement there where they are getting reinforced for having that problem behavior, whereas they wouldn't have gotten that otherwise. So I've laid out here some 5 different things that can be used when we think about effective reinforcement. The first one is that we want it to be immediate. So you want it to be delivered as soon as the behavior that you want to see happens. Even sometimes in the middle of that behavior, great job, playing with your sister. We don't have to wait until they've thrown a block at their sister, wanting to get in there at the beginning and try to give them that positivity. We also want reinforcement to be contingent. So only give it if you observe the behavior that you're looking for. So if we take that situation of going to the grocery store and, working for a candy bar, the only way they get that candy bar is if we observe the behavior of having the calm body, or however we want to phrase that for them. If they don't have it, they don't get the candy. And so that's super, super important. We want it to be varied. So we want to think about different types of things that we can offer to them. Giving them a Kit Kat every single time they go to the grocery store probably is not going to work eventually. So not wanting them to become, satiated on whatever item it is that we are offering them. We want to make sure it's also that it's preferred. So something that they like, we might like Kit Kats, but maybe our kiddo doesn't. So making sure that those are things that they enjoy. This also may change depending upon what's happening. So maybe they just had a Kit Kat with their lunch. It might not work to offer them a Kit Kat, for having that calm voice through the store. So we might need to switch it up, do those sorts of things as well. And the last piece of effective reinforcement is when we're giving it, we want to be really specific about why they're getting it. So instead of just saying good job, we can say, good job putting your toys away, good job, putting your PJs on. It kind of takes out any sort of thought that they might have for another reason why they're getting it. So it makes sure that your intentions are super clear to them as far as why it's happening. Just a little bit more into our play-based learning. We look at goals for socialization. So we look at increasing interactions with their same age peers. We use the play-based learning to generalize goals. So sometimes we've learned a goal at the table and we can now take it out into the natural environment to play with toys and kind of expand on, maybe we taught them learning colors at the table and now we're learning colors with the blocks. So it just allows us to look at it from a lot of different perspectives. We also can look at appropriate play. So by having play with the toys, we can increase their ability to engage with same age peers, but also increase like the different types of reinforcers that are available to them by just exploring the environment. We can work on independence by increasing the amount of things that they can engage with independently, so they're not requiring that constant adult interaction. And we can also use toys as reinforcement. So these can be things that the child has an interest in. And so they want to learn whatever the activity is that we're trying to teach because it's associated with something that they also find super fun and reinforcing. And one of the last pieces of our kind of modality with therapy is that parent collaboration piece. So as a parent, you're going to spend way more hours with your child than any practitioner will. So by having that parent collaboration meeting with you weekly, we ensure that you're learning some of the strategies that we are also using to help with behaviors, and that can be instrumental in helping to cease those problem behaviors. So we meet once a week. We may have you work on collecting data. We talk about strategies that we're using and how you can implement them at home. We talk about any questions that you may have and any sort of problems that may have arisen throughout the week to kind of brainstorm and kind of figure out how we can help in those situations. And anything else that's important to you as a family, kind of a time to debrief and kind of work through some of those problems or situations. So thank you very much.
That was awesome, Emily. Thank you so much. That was super informative, and I learned a lot. My daughter is 13, and I wish I had some of this information as she was going through her younger years, but I really feel like I could apply that now. It seems like it could apply at any age.
It definitely does. And like you said, no matter, your kid has a diagnosis, no diagnosis, it doesn't matter. These are, behavioral principles that you can utilize. I utilize with my toddler. So you can definitely utilize them with.
Now, quick question that I thought of, and maybe some of the individuals are thinking this too. Can you apply this strategy with adults too?
Absolutely, yes.
All right, that's great.
Yeah,
That's
so
good
you
to
can
know.
utilize it at your business. There are people in my field. It's called it's like a subset of ABA called OBM, Organizational Behavior Management, and they utilize it with Fortune 500 companies across the globe where there are BCBAs going in and helping managers deal with their employees, wives, husbands, partners, all of that stuff.
Yeah, I could totally see that. It's nice though if you can raise the child in this direction from the start. They'd be used to that and working with it and understanding it, and probably develop into one of those individuals who would respond really well to that type of coaching and consulting that these Fortune 500 or other companies go through. So we did have a question come in. Marta had asked, how do you transition out of the reinforcement with reward phase? Or how do you transition out of that reinforcement with reward phase?
Yeah, that's a wonderful question. With that, we always try to pair, if we're giving some sort of reward, like a piece of candy or something like that. If we're doing something like that, we always try to pair it with praise. And that way, eventually that praise can kind of stand alone. Oftentimes at the beginning, like it doesn't work. Like if you think about toileting a young child, like just telling them good job, like sometimes that's not enough. So you have to add that piece of candy or that little toy that they get for doing it. And so by pairing it with those two, having the praise along with that edible or that toy or that item, the praise then becomes what we would call a conditioned reinforcer. So it can then kind of stand alone. So eventually we can get to the point where we just tell them good job. And eventually, we can thin that out too, where, my toddler no longer needs to be praised every time he goes to the bathroom. So, thinning that out as well. Sometimes that comes more naturally. Sometimes we have to specifically plan for it. So it just kind of depends on the individual, but definitely recommend pairing that praise and then trying to thin that out as well.
All right, great. Yeah, that's really helpful. So a question that has come up before in other conversations is this. What can you recommend for a parent who's having issues with their little one interrupting the adult conversation? So mom and dad are having a conversation, or maybe mom's having a conversation with their pediatrician, and the child keeps mom, 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 or trying to interrupt. I know the general tendency is to let the child talk and to involve them in the conversation, but honestly, sometimes it's a distraction, even especially when you're trying to get information, say from your healthcare professional, or you're involved in a deep conversation. So, as a behavior analyst, what would you suggest the parents could use and apply to a situation like that?
Yeah, that's another great question. I think that's another thing that needs to kind of take, you can't only work on it in that situation, if that makes sense. So they need to practice that, give the kid lots of opportunities to practice that skill, like even at home while mom and dad are talking, while mom and grandma are talking. And I would probably utilize like a wait protocol. So like teaching them, like, okay, we need to wait a minute. And like letting them, you might need to start off where that wait a minute is like 5 seconds until you can kind of get them to be able to wait, longer durations of time. But definitely practicing outside of that, specific setting for the doctor's office, because you might go to the doctor's, every other month or once every 6 months. So if you only practice it there, there's just not a lot of opportunity for teaching. The other thing that you can work on is those, like I mentioned, those independent skills. So is there an activity? I'm not saying you need to put an iPad in front of them, but is there an activity or something that you can bring that they could do? Could they color on coloring sheets, or could they play with Play-Doh for a few minutes while you have that conversation? Like, is there something that could occupy them during that time as well?
Yeah, those are great suggestions. Thank you. You brought up the electronics. Could I have your take on electronics and children and how that works from a behavior standpoint? I'm curious to hear your input.
I don't have a behavior standpoint as far as like whether I think they're good or bad. I think that they have their place. Personally, like my toddler doesn't have a device. Like he's not, when we go to restaurants, like he's expected to sit and, we work on some of those strategies of like, can we take coloring books? What can we do, preventatively to keep his behavior? There's a lot of mixed opinions out there about whether they're good or bad. I think that like anything, it's good in moderation. we take an iPad with us when we go on a plane, like as a backup. But outside of that, like he doesn't have access on a daily basis to technology like that. That's my own personal opinion about it.
Yeah, that's great. Thank you. I really appreciate that. Okay, last but not least, if you could turn a cheat sheet over to a parent, what would be your top 3 tips in a nutshell that you would say to a parent?
Yeah, no, that's such a great question. I think my first one would be follow through. I think that's such a huge thing. If you're presenting all of these sorts of situations to your kiddo and then never actually, following through, if you are at a party and you say, if you keep doing that, we're going to leave, and then you never actually leave. If you tell them that you're going to give them a piece of candy for doing something and you don't do that, that can be equally as detrimental to that relationship. So like really trying to build that trust up from both sides of it of, if you're telling them you're going to do something, you need to do it. If you don't want to leave the party, don't make that a thing. So I don't know if that would be number 2 or if that's kind of combined. There isn't a rule book that says that you have to say those sorts of things to your kid. I think that those are sorts of things that kind of come out naturally, like you don't realize what you're saying. But if you don't want to leave the party, don't say that. Set some other contingencies up to try to handle behavior. I guess my next one would be really focusing on the positive. I think sometimes we get so wrapped up in cooking dinner or the things that we're trying to do that like we don't attend to behavior until it's to the point where we have to attend to it. When the siblings are in the other room screaming at each other and we forgot to pop in 5 minutes ago when they were happily playing Candyland together. So making sure that we're focusing in on those good moments of things that they're doing. And the last one, I guess, would be maybe asking for help. I think, getting together and talking about what other people have been through, things that have worked for them. Obviously, if you can lean on somebody who has that behavioral background or, your child needs that level of support, I think that's great. But I think, talking to other families, sometimes they've come across a lot of great tips that, they had to get, going through the battle. And I think a lot of times parents are willing to share those with you if you're open to hearing what it is that they have to say.
That's awesome, Emily. Thank you so much. And, I have to acknowledge, I think most parents, unlike you, are not behavior specialists and they do need help. And so on that note, how would a parent reach out to you for help?
Yeah. So you can go to my website, thebehaviorinstituteaba.com. You can also email me at emily@thebehaviorinstitute.com.
Okay, awesome. All right. Well, thank you everyone for attending. Thank you, Emily, for such a great discussion. And we keep these things happening on a regular basis. We'll send out notifications when we have more of these sort of webinars that can help you as parents help your children. So be on the lookout for that. Again, my name is Dr. Leslie Pasco from Mile Way Centers for Kids. Thank you all for attending, and everyone have a great day.